Okay, well, thank you all for being here. We've heard in the last couple of days from CDC that they've detected Ebola virus D68 in specimens from, enterovirus. What did I say? Ebola. Oh, man. Enterovirus D68. I'm getting my E-viruses mixed up. Enterovirus D68 in specimens from a few people who had died across the country in response to samples submitted for testing. The role that the virus played in those deaths is unclear. Both CDC, state, and local health departments are continuing to investigate. I particularly wanted to talk to everyone because I wanted to make sure everyone understands that this doesn't change the situation and how we think about enterovirus D68 at all. Enterovirus D68 is acting like a virus, and we see this kind of thing with viruses frequently. Now, there's some other information. There was the death of a 10-year-old child from Cumberland, a tragic death, and that child died from overwhelming Staphylococcus aureus sepsis. Cultures also showed the presence of enterovirus D68, and it's not clear, what role the enterovirus had, but clearly the death was a sepsis death. This is an overwhelming and tragic infection which happens sometimes after viral infections of various descriptions, and sometimes even happens without viral infections. Now, one thing I need your help with is, I spoke to the family yesterday. They wanted me and they wanted the department to let the physician community know that this had happened, just so people could be aware. But this is Rhode Island, and it's not going to be hard to figure out who's who. We would really request that you do everything you can to protect their privacy. They've gone through the worst tragedy a family can go through, and they're approaching this with tremendous courage and tremendous love. From what I understand, this was a beautiful child, and I think we all ought to just circle around them and just take care of them as best we can. So we're not going to release any more details about the specific case, and I think you can understand how we all ought to work together to take care of them. So you might want to know how something like a death like this might happen. From an infectious disease perspective, this is a disaster for the patient, for the child, and it is from an infectious disease perspective really a perfect storm. The combination of Staph aureus and D68 is very rare. This is an isolated case, and which obviously led to a tragic outcome, but is not something we expect to see again. And so most of what I wanted to do was give everyone the opportunity to get through so that people understood it in the correct context. This is not, we are not any different from where we were when I talked to you a week ago. For most people, enterovirus D68 will be a mild illness. For many of us will have it, and it's nothing for most of us more than a cold. The care is entirely supportive. There's no vaccine and there's no specific treatment, as we don't have treatments for the common cold. The take-home message, if there is one, is, make sure your kids are washing their hands 5 or 6 times a day. Make sure that anybody with asthma has their asthma under good control. And then, it's October 1st, so I'm going to say, please make sure you get a flu shot. The flu is a virus that we can prevent, and so we should prevent it. Other viruses are harder to prevent, but we've got one that we can prevent, so we should provide it. We should prevent it. And with that, I'll open to questions.
Did the boy pass away in the hospital? Was he at home?
It was a girl, and she passed away in the hospital. The people who took care of her did a phenomenal job taking care of her.
Are you investigating for a possible link, her death, a possible link with EBD68?
Well, I mean, there clearly is a link, but we're not sure what the meaning of the link is. So the viral cultures showed the presence of enterovirus D68, but the cause of death was really the Staph aureus sepsis.
When will we know more about that link, do you think?
Well, I think we know what we know. I don't think there is more to know. This is something that happens rarely in medicine, but it happens. It's a tragedy when it happens. It's a perfect storm.
Do you have a sense of, I just want to make sure we characterize how the EBD68 was involved.
And I don't think we're ever going to know the answer to that with precision, but we do know that the death itself was overwhelming staph sepsis. And that's when it happens is a very difficult condition to treat.
Do we know how she might have acquired the staph infection?
That is unknown, but one of the things that's hard for folks who don't do this for a living to understand sometimes is that we live in a world in which there are lots of viruses and lots of bacteria. And so many of us carry a little staph in our nose. Our bodies have bacteria and viruses in them all the time. And so the issue isn't always how did that bacteria get to one person, but what were the conditions under which that the bacteria kind of overgrew and took over, and did so scathingly quickly.
Is it safe to say that this child's immune system was diminished because of the enterovirus?
We don't have any way to know that with any certainty. We don't know which came first, and that's not possible to know with the current state of our science.
Well, last week there were questions about whether or not this death was related to enterovirus. Why did the Department of Health say there was no link at that time?
Well, at that point, all we knew about was the staph sepsis, and the staph sepsis seemed to be a totally adequate explanation.
But we understood at that time that there was testing being done for enterovirus, and it seemed like that was squashed, even though the test hadn't come back. Why was that?
Well, it just hadn't come back yet. We had no reason to think that it would be positive, but the reason we do the testing is to double check.
And Dr. Fine, can you talk a little bit more about which children are more susceptible to enterovirus? Because it seems like this was a child who might have had health problems.
No health problems.
This child didn't have any.
This child did not have underlying health problems.
No compromised immune system.
Not as far as we know. No, healthy child. We are all at risk for enterovirus, every single one of us, and many of us will get it, and many of us will experience it as a cold, which is kind of what I said last week.
Why was she hospitalized?
Yeah, why was she?
Well, her parents, in a very, very short period of time, she got a little short of breath. Her parents didn't think much about it, took her to the hospital, and really by the time she got to the hospital, everything fell apart very quickly, within 24 hours.
When parents see this, I know that a lot of them are freaking out over this. They see a healthy child who, has the virus and then is sent to the hospital and dies 24 hours later. Should they, you don't want them to freak out at this point, obviously.
Right, because most of us who have colds, and don't, it is exceptionally rare for something like this to happen, so the right thing to do is to do what we always do, which is, use your head, wash your hands, get a flu shot, and go to see your doctor if you feel sick.
Has anyone at that little girl's school been tested? Are they showing symptoms?
Well, we wouldn't be testing. Knowing our working assumption is that every Rhode Islander is at risk for, or is, most of us are going to get a little enterovirus infection, and that doesn't change the course of the Nile. It's the rare case where something happens, and this may not have been related at all to the enterovirus infection. It may have been something that we call true, and unrelated. That enterovirus was there, and the staff was there, and how and why they interacted the way they did, we just don't know.
Have there been any cases of children with the kinds of neurologic illness we've seen, for example, in Colorado, who also have tested positive for EBD68?
Well, I haven't heard of any, Dr. Brandy. I don't think we have in Rhode Island.
Confirm that in any cases in Rhode Island yet, but that may change.
It may happen. But the other thing to remember is, if you read the CDC description, what we're seeing is these cases occurring about the same time as enterovirus infection. And I'm not sure anybody really knows. I don't think anybody has yet gone through and tested the kids who were experiencing symptoms, so I don't know if we know how much correlation there is. But again, just because you don't have enterovirus today doesn't mean you didn't have enterovirus 3 weeks ago or 6 weeks ago. So working out these relationships is tricky, and that's why this department is filled with great epidemiologists, and why we have the opportunity to work with a bunch of great epidemiologists at CDC, including Dr. Bandy, who works here and is closely connected to CDC.
Will this child's death in Rhode Island will there be any continuing investigation?
I don't think so specifically, Dr. Bandy. No. What will happen, I think, is that CDC will look at what's happening around the country, and then, if they see patterns, a few months down the line, we'll look back and try to analyze what's happening. But there isn't close enough correlation for people to study with much more precision.
Is there
at
a
the current.
certain threshold when a parent should feel like, all right, it's time to, this maybe is something a little more serious than a cold, I need to go to the hospital? Is there something that you might advise parents on in that manner?
Well, I always think shortness of breath. If a child is complaining that that the child is having a hard time breathing, that's one thing to pay attention to. Fever that lasts more than 3 or 4 days. Parents are good at this. Parents are smart people, and parents know their kids. So rather than hard and fast rules, it's just, it's better for me to suggest that parents look at and know their kids and know when something isn't right. And it's also important for parents to have good relationships with a nutrition or family physician or nurse practitioner or PA, who they can get on the phone and say, this is what I'm looking at. What do you think? That's what, that we have a great primary care community really gives us the ability to think this stuff through together. I spent a good part of my life being on call and answering these phone calls at 3 in the morning. And sometimes I'd have kids come over, meet kids at the office and just take a look at them. And that's what our great practicing community does all the time. And we're happy that they're there and happy that they do it. It's a partnership, and we do it all together.
Dr. Fines, you mentioned the CDC. Is this the first enterovirus possibly related death that they're looking at, or are there other ones?
We have heard that they're about to post, actually in an hour or two, some information that says there are a couple that they're looking at. They're not sure what the association is. So it is not the first, by any means.
Is this one of the cases they're looking at?
Again, looking at, I want to use loosely, this is one of the cases they're cognizant of.
Have you reached out to the CDC? Are you in communication about this case?
Well, we talk to the CDC all the time. So, this is the kind of information that passes back and forth between us all the time. We are either on the phone or on email or on conference calls with CDC pretty much every day of the week. And this, the way you do good public health is to have everybody stay in contact.
When did the family find out that the child did test positive for enterovirus?
When I talked to them yesterday.
So they found that yesterday?
Yep.
And are the school officials and other students there, were they notified by the health department or through the school?
I don't know if we've even done a formal notification, because again, enterovirus is out there. This is nothing that, this is not anything different from the normal set of viruses that are out there. But I think everyone in the school is trying to process, the loss of a 10-year-old, which is, the emotional consequence of that is huge. And that I know they've been working on with us and working on with others.
Can you really quickly?
Excuse me, we have time for one more question.
I was just going to say, could you go through the timeline very quickly one more time? What the parents noticed breathing problems? Just walk me through that timeline.
As I understand it, and I'm not as precise, I think the child was staying someplace else, came home, noticed a cold. The parents noticed some breathing problems, and they said, "We don't like this." As I understand it, they called 911 almost relatively quickly, and very quickly after they got to the hospital, things became dire. This, again, this kind of thing happens in association with viruses, and sometimes by itself. It's not frequent, thank God, but it happens once in a while. So.
Oh, I'm sorry. Can you talk a little bit about the child's health? You said this was a healthy child.
That's my understanding.
So no prior infection?
No prior infections, no underlying disease.
Just all of a sudden?
Right. And again, this is, unfortunately or unfortunately, this is not the first time we've ever seen this happen. This happens in Rhode Island and around the country once in a while. And it's a tragedy when it happens. And that's about as much as you can really say about it. It does happen. And it's a tragedy every single time. But it's not necessarily a preventable tragedy, at least at our current state of science. The thing to remember is, in particular for enterovirus D68, we don't have a vaccine. We don't have a specific treatment. But what we do have is a vaccine to prevent flu, which is a virus that kills 30,000 Americans every year. And if I was going to say there's one take-home message from this, my take-home message would be, let's get everybody vaccinated against influenza, because that's something we can prevent. Thank you all. Thanks for coming.